Dr. Hood.
Good morning.
Hi, Dr. Hood. Can you hear me?
Yeah, I can hear you. It's a little bit greeny.
I know. I think somebody that called in isn't on mute. So let me see if I can mute them.
Okay, no problem.
All right. If you're on the call, can you mute yourself?
Oh, that's good.
Yeah.
No, it was good.
There we go. You can see my screen.
Sure.
Perfect. We'll start in just 1 minute.
All right.
So miigwech merci beaucoup, and thank you for joining us for our Health Sciences webinar on spirituality and occupational and living model, the conceptualization of occupational performance through the lens of spirituality. It's delivered by Dr. Clark Hurd, occupational therapist, associate scientist, and adjunct research professor. I'm Jennifer DeBaker, and I am the Programs and Partnership Coordinator here at NOSM for the Health Sciences programs. Before we get started, we will do some quick welcomes and introductions. So just a reminder about your microphone being off for the duration of the webinar. This webinar is being recorded and will be posted to our RS and NODIP website. If you do have any questions throughout the presentation, please feel free to put them in the chat. We'll also have a dedicated question and answer period at the end where Dr. Hurd will answer any questions that you may have. All of our previous webinars are now on YouTube, and you can find those links at our RS and NODIP website under the resource section. In the spirit of truth and reconciliation, NOSM University respectfully acknowledges that the Pan-Northern Campus is on the homelands of the First Nation and Métis peoples, specifically Atikameksheng and Wahnapitaea First Nation and Fort Williams First Nations. Beyond a land acknowledgement, we understand that reconciliation is a practice. We gratefully acknowledge the elders and knowledge keepers who share their gifts and teachings with us so that we may better understand and honor their wisdom and that of all the traditional keepers of this land. NOSM University will continue to practice reconciliation by listening, learning, and fostering a culture of mutual respect and trust. Our presenter today is Dr. Clark Patrick Hurd. He's a staff occupational therapist at the Southwest Centre for Forensic Mental Health in St. Thomas, Ontario, where he is also a principal investigator for the Occupational Therapy Spiritual Care Research Lab. Clark is a graduate of McMaster University and Temple University in occupational therapy. He holds a faculty appointment at Western University and is associate scientist at Lawson Health Research Institute. Clark has a high volume of scholarly publications. An active clinical educator, Clark has precepted over 130 occupational therapy students. An award-winning clinician, he has been recognized by the Canadian Association of Occupational Therapists for excellence in clinical education. Clark is also a recipient of the Sister of St. Joseph Award of Excellence in Care, the Unsung Hero Award from McMaster University, and most recently with his colleagues at the Research Lab, the Professional Practice Award as a team at the St. Joseph's Healthcare in London. So merci beaucoup, miigwech, and thank you. Dr. Hurd, thank you for your time today. We truly appreciate you sharing your knowledge with us, and we very much look forward to your talk and the opportunity to ask questions. I'm going to put your slides up in 1 second.
Oh, that's fine.
Can you see the slides?
I can. Thank you.
Perfect.
So I'll just ask you, kindly to advance them. Sometimes I control the screen, but sometimes when I teach, it's hard to have the tech work for you. So especially when you're at distance, so it's probably inconvenient, perhaps a little easier. Yeah, if you can just advance it past this one. And so I do work. This is the hospital where I am an employee and where I also support a research lab. So my clinical day-to-day practice is here. And so while I am a faculty member, I have a clinical practice, and I do work with individuals every day. I will state in advance, I may veer into the term patient at times. And I say this without apology. My facility at Lawson Health Research, through the guidance and direction of our patient council, did undertake a survey of all of the individuals receiving care across our campuses and sought to learn what the term they would prefer to be addressed as. And as you might imagine, scientists followed up on this with various terms: patient, consumer, others, client. And ultimately, the preferred nomenclature here at St. Joseph's Healthcare London is patient. And so I do tend to defer in that area. Second thing I'll say in advance is that I did have the opportunity more recently to present this content at the Australian National Conference, and was invited there, and that was nice. What I noticed there was they also support a land acknowledgement that I found very meaningful, and so I tend to use it in my practice. And so in the Australian context, they say that they would like to acknowledge any elders present, any elders emerging, and the original caretakers of the land, with the acknowledgement that we are only taking care of the land with the permission of our grandchildren. And so I would like to acknowledge any elders who are present and any elders who are emerging accordingly. So if we could move on to the next slide. So that's my bio. If anyone's interested, that I do have a code on there. And so if you're interested, you can scan that, and that'll take you to my LinkedIn. And you can feel free to connect with me via LinkedIn. So there we go. It's my little girl at the top there. So we'll go to the next one. So what I'm going to start with is the spirituality problem. And this is one that has kind of interestingly, when I say plagued our industry, it's been a discussion point for a long time in occupational therapy. And so essentially, there's been a really high volume of assessment analysis on spirituality and occupational therapy. And I'll go into that in a bit more detail. But the problem is that while we put spirituality at the center of the Canadian model of occupational performance engagement, and we say to our students, spirituality is at the center of the person, and we say that to them. And so, and this, by the way, in some ways is why I developed this model. When I teach students, and I teach about a dozen a year precepting, and what they would say to me is, they say, well, Clark, what am I supposed to do with that? Like, I want to engage with my clients, in terms of their spirituality, their spiritual journey. What do I do with it? And we really weren't clear as a profession about those things. And so what we ended up with was whole segments of the profession that just kind of wanted to get rid of the whole thing: relevance questions, definitional concerns, and clinical application. And so when you have leadership documentation that's saying, oh, we should engage with spirituality in this one way, but then we have an inability to easily narrate it. And what ended up happening, and I reviewed I think I reviewed literally everything that was ever written on spirituality and occupational therapy. Pretty sure of it. And what I found was, there wasn't a theory framework or conceptual model that had supported practitioners, and it's really consistent with what Newbigging wrote in 2017. While we talked about it, there was nothing there that was allowing for us to frame occupational performance in day-to-day clinical practice via a spirituality lens. And so That's why I kind of moved on to this work. And so we could advance to the next slide. And so, what's the problem? Well, realistically, the problem is spirituality in clinical practice. And so, Morris identifies the gap in stated theory and actual practice. So there's a level of that being spoken about in CMOP-E, in the framework, in other places, but on day-to-day practice, you couldn't frame somebody's occupational performance using a spirituality lens. And then Newbigging, of course, identified that, maybe it'd be a good idea to put together such a theory. So we'll move on to the next page. So it's interesting that we've actually been working on spirituality concepts in occupational therapy, for about 50 years. So according to Urbanowski, there's actually multiple health and welfare task forces, 83, 86, 87, but Brentnell actually identified an even earlier start in 79, where there was an interest in our profession in occupational therapy, in spirituality and occupational therapy, which I find really compelling. Like the idea that, that we've been thinking about that concept for this long, but really hadn't really thought of a way to make it operational for clinicians. So we'll go on to the next slide. So when we think about it, it basically entered the mainstream. So spirituality was a topic of discussion among these task forces. It entered the mainstream in 91 in the original Canadian model of occupational performance. So before the E got added. The original CMOP, if we go on to the next slide, was also applied in the PEO model. So Mary Law, Deb Stewart, saw the person holistically as a composite of mind, body, and spirit. It's interesting that in the original conception of the Canadian model of occupational performance, spirituality was actually seen as one of the factors that influenced or was influenced by occupation. So not simply the center of the model, but actually a more dynamic part of the model. And so that changed with the revision in 97 in the original development of that model. So we can go on the next slide. There's also, spirituality is also applied in the framework. So if there are any, like myself, I'm an American educated occupational therapist. I did do my my first degree in OT at McMaster University in the 90s. However, I did my graduate school at Temple University in Philadelphia. And so I had to learn the framework. And so the framework is the overarching document in the United States. Kind of like the way that we would look at, our overarching documents here, but I don't know, it's quite different. In the framework, spirituality is not perceived as the center of the model. It's not seen as the center of the person, but rather it's seen as a factor of like one factor that informs the client. So there's other client factors like values, beliefs, body functions, body structures. Those are all factors. So spirituality is one factor, as opposed to like the sort of more central element of the person, which is the way we see it, here in the Canadian construction. So it's quite a different worldview. Nonetheless, there remains a very significant interest in spirituality, and much of the modern literature, I would argue, is driven by American authors. And certainly in our era now, the majority of publication and books are driven by American scholars. So we'll go to the next slide. So I will say to everyone, just so and I just explain this, when I put my slides together to teach places or to talk, my areas of research interest are in occupational therapy leadership, which is where I did my grad work, in spirituality more generally, and mental health, where I work. And one of the studies that we did looked at eco-spirituality and participation for individuals with serious and persistent mental illness in a forensic environment. So the idea that we remove the ability for folks, because of the incarcerative nature of forensic mental health care, we remove their ability to participate meaningfully in nature the way that most of us do, and we therefore remove that spirituality element. And while I am taking a slight break from my own talk here to describe this, it explains all the pictures in the presentation. So I like for folks to know why they're going to see all these pictures. And so when we did the eco-spirituality group and the eco-spirituality study, what we looked at was how could we support these folks to have maximal nature participation while still meeting the unique needs of the forensic facility where I'm employed. So we have certain security and professional requirements and community safety requirements. And so we were able to figure that out and enable folks to have the ability to interact with nature. And so each of the pictures are places where we went with the clients. And so I like to include those for two reasons. One, I like a certain amount of visual interest in my slides. I think that's just a pro move in general. And two, I think it just provides an interesting narration and gives you a little bit of visual interest. So when you see those pictures on there, otherwise I like to say that because I think people will be like, why is Clark putting those interesting nature pictures on his stuff? But this is actually from a co-occurring study of spirituality we did at our facility. So in terms of analysis, Egan and DeLatte in '94 rather presciently offered that the exact role of spirituality in occupational therapy has been difficult to delineate. I am not sure that there is a more true statement has ever been made in our profession. And so if we go on to the next slide, we can just take a second here, and I'm not sure how many participants there are in the room, but perhaps if folks who are participating, want to take a shot here at defining spirituality in occupational therapy, just a couple. Then I don't know exactly how you speak out on this platform. We use a different platform at St. Joe's where I work, but feel free. How would you define spirituality in occupational therapy? I think you could also put it in the chat window if you prefer.
Yeah, and feel free to take yourself off mute. All you have to do is hit the mute button, the microphone button, and it will take you off of mute.
Hi there, Sheila Renton. Oh, I was glad. I was really just trying to fill the air because I'm an occupational therapist, trained in the 80s, and really am struggling with the definition. So I will defer to Jenny. Thank you.
Thanks, Sheila. I'm Jenny. I'm also an occupational therapist, but trained in 2015. So I'm actually struggling with it too. It didn't come to my mind like quickly as other things would, but one thing maybe that did come to mind is maybe things that, well, with occupation, like are meaningful or that we can relate to, whether, I don't want to like say spirit because that's a part of the term, but that's kind of where my mind goes. It's difficult.
It is. I appreciate you. It's hard to speak out and think about these things because we talk about it in OT school and then we kind of leave it. And yeah, I don't know if there's anyone else who'd like to contribute. Okay, I'll move on to my next slide here. So, I have that part in my presentations and discussions because two things. One, I think there's a lot of views on spirituality in our business. And two, I think that it's been a struggle for a long time. And so the struggle that participants have here today is the same struggle that our profession has had in terms of understanding. And so I actually captured it in my article, and I capture it, in the model. The demand of definition is how I captured it. And so this idea or concept that our profession is, we like the idea of spirituality, but our profession has oddly been obsessed with defining it and really coming to a specific definition. And so I've included a number of these, and we'll go through them. Some of them I find sort of amusing in the modern era. And I respect the authors for giving it a shot, because you got to respect anybody who makes the effort to publish. But sometimes I see these things and I'm like, wow, I work with clients every day. I work with people every day. The idea of having to look at my teams and go, okay, spirituality, when they say, well, Clark, what are you talking about? And if I said, the sense of one's purpose and place in the universe, the psychiatrist here would look at me and wonder, like, what do you mean? Like, let's get a little more specific here. Um, the same thing when we say experience and meaning in everyday life. Okay, maybe the essence of a person expressed in daily actions as influenced by values, belief systems, and social culture. I mean, that's just a lot, like there's just a lot. If we go to the next slide, kind of go into it a bit more. So that's actually at Waterworks Park here in beautiful St. Thomas, Ontario. Sense of harmony with self and between self, nature, others, in some cases, the ultimate other. So we start seeing this recruitment of some sort of higher power, kind of exists as well. The CAOT 97 one, honestly, it's just too much for me. And, I respect the authors, but pervasive life force manifestation. Like I read that one, I always think of Star Trek for some reason. It's so big. Self-determination of meaning, connectedness, and like there's just a lot going on. It makes me think of like the Borg in Star Trek for some reason. It's like so big. We can go on the next one. And so what became of that? So people got kind of frustrated, it seems to me, when I review the literature over time. And folks got kind of frustrated, and so they actually started coming up with new ideas. So like Hamill in 2001 actually offered that what we should do is just throw away the sort of the whole spirituality concept and just rename it and call it intrinsicality. And so this idea that spirituality is like, it's just too much. And so it's weird because I find when I read her stuff, it reads a fair bit like spirituality, dare I say it, but nonetheless, and then Kang in 03 is looking at sort of, again, this kind of ultimate thing, which is again big. And then we see like again Pacholsky in the framework, and again like these concepts are so big. The problem with them being like this is that attachment to wide and diverse groups of people is hard. And so when we look at this, the personal experience of spirituality and the personal narrative of spirituality, when we seek to express meaning and purpose and connectedness, may or may not be relevant to you. And I think this is the kind of hard part what I had with a lot of these models. So we'll go on, and I think the last one here, which says most struggle to define spirituality. I thought, yeah, there we are, right? I mean, what changed between 77 and 2015? So if we go on to the next slide, this is where I struggled as an author, as a scientist, as a theorist. The professional desire for definitional consensus. We don't have that in any other area of our profession. So we demand this in spirituality. Somehow we all got to sing from the proverbial same hymn book. But splinting, wheelchair seating, SI, psychotherapy, for heaven's sakes, environmental modification, cognitive assessment, design concepts. Like we could go into so many different areas, and we don't expect for there to be any critical agreement. In fact, we argue that innovation is enabled by not having that agreement. So we don't necessarily define. I'll be honest with you, I'd like someone to define how to better do an elevating leg rest than our current solutions. And that's the innovation piece. But we don't demand consensus on splinting. We say, okay, if somebody comes up with a better idea, we're good with it. But for whatever reason, when the profession seems to get frustrated with an idea, we demand consensus about that idea. And I see that even now in certain studies. So we'll go on the next slide. So, so then what happened? Well, I realized a couple of things. I realized I should probably try to. My students came to me and they're like, Clark, what do we do about this? And I thought, in 2009, I started working on this thing. And it took till 2023 to publish. Like, Like, I mean, honestly, between then I did a doctorate, and, I got kids, and, there's like things going on in my life, but taught a lot, like did 8 other research projects or something, but, it was always there. It was always there. And it took a long time. And what I realized was I was going to have to define or offer a definition of spirituality. In the article, I discussed this as the cost of entry. And so the idea is that if you don't offer honestly, I know I was in Philly and I talked to my colleague, and she said, well, how do you define spirituality? First thing I was like, I'm writing a model on spirituality. She's like, that's great, Clark. How do you define it? Like the first question, right? And so I came up with one. It took me a minute. I was running on a trail, and I was at like about kilometer 17 or something. And it finally came to me, and it was good. I said, the sum of experience that each person holds personally sacred. And so this takes us out of that place where we're talking about ultimate others, and it takes us out of that place where we're talking about connectedness, which may or may not be relevant. It takes us out of that place that's a little bit metaphysical, a little bit, like that. And instead takes us to a place where each individual, i.e. my client, is able to define their own things that they hold personally sacred. And it's easy for me to explain that when I utilize the model with my clients. And I do use the model with my clients. So in context, it speaks to what Evans refers to as things set apart with special meaning. And so each one of us has those things, but those things for each one of the attendees in the room here are different. And so for some people, it may well be what we would look at as conventional religious participation, spirituality in that way. It may be that. Maybe going to a mosque is where you derive some feeling of comfort, and that experience is what you hold personally sacred. It's possible. Maybe going to a Catholic church is that thing for you. Maybe walking a labyrinth is that thing for you. Maybe walking your dog in nature is that thing for you. It's not my role to judge it. It's not my role to even consider the why questions. It's my role to ask you what you hold personally sacred. And I think that's the key here, is that this approach, when you define it that way, completely changes the focus. The prior definitions, I would argue, were clinician or profession narration. And the power in that dynamic doesn't rest with, and it shouldn't rest with me, but it does. Whereas in this dynamic, the power doesn't rest with me. It rests with the individual with whom I'm working. And it enables for that individual to define their own personal spirituality. And so, that's a very different approach than has historically been undertaken. So moving on to the next slide. And so this is the SOiL model. Now, I got to admit, it's really pretty now. When I first developed it, the ideas were exactly the same, but I did it myself using Microsoft product. And my students came one day and they looked at it and they completely understood it, but they were like, dude, it looks like it's done with Microsoft Paint by a child. And I was like, well, that's very mean of you to say. But realistically, I was able to hire a graphic designer, and it made all the difference. And so you can see there that what we have is a set of relational inputs. So in terms of the SOiL model, each person has their own spiritual soil. And the depth of that soil, it offers us the ability to temporally represent that person's life. And then, as you can see, there's space made for relational inputs, illness experience, occupational performance, and also mood and affect. And we'll go through each one of those things and talk about those. And we'll do a little case study and talk about how I make it work in my own practice. So we'll go on the next slide. So let's conceptualize a little bit here. So you can see that the sum of experience that each person holds personally sacred is captured as their spiritual soil. And so that soil is cumulative and it evolves over time. It also changes in composition in days and weeks and months. And please note, and I tell everyone when I teach this, you don't have to use any of the symbolism that I use. The soil is relevant, but everything else is really between you and your client. And so you have the option. I use trees for relational things because, they're kind of living and growing, and it's pretty symbolically easy to do that. But you want to use skyscrapers or houses or whatever, doesn't matter. And it's just, for me, it's easy. The roots are pretty easily translatable. And folks generally understand that. But I've worked with people that want to use different symbols, and works out just fine. So however you want to figure it with your client is kind of your call. And so the soil changes in composition over days, weeks, months, and years as new experiences are added. And the depth gives us that temporal aspect that allows for us to narrate that individual's sort of spiritual journey and in their life. So moving on to the next slide. And so when we think about relational inputs, those mark our spiritual soil, and they mark our understanding of what we might hold personally sacred. For some people, that might be parents or children. I've many times had symbolism for people's dogs, other things, and you can choose again. The agency is with the client, so that when you speak with them, you have the ability to really open a door to talk about, okay, well, how do we want to represent this? And I say this because I find I get a lot of really relevant information from my teams, when I have these kinds of discussions. And so people will identify what's really driving meaning for them in their relations, and in other areas as well. And so, but you can choose to, kind of represent, those relations as you wish. So we'll move on to the next slide. And so here I'm thinking about occupational performance. Occupational performance, as we know, is dynamic and change, and it's always kind of changing. And so I like to use plants, grasses, flowers, crops. If I pointed my camera out the window right now, you can see a farm field next to my hospital. This is where we are. This is where I grew up. And so for me, this kind of, rural sort of situation, it drives meaning for many of my clients the same. People, sort of see crops or that as a reasonable symbolism. And so what we tend to do is look at how I tend to do it is longer term participation. And you can see like the cornrows there. So if you were thinking about someone at university, those cornrows could each perhaps be 1 year at university. Where shorter, something like maybe that one on the right, which is much shorter, maybe that's your summer job or whatever, you want to, again, whatever you're describing, whatever that meaningful occupation might be. And clinicians have the agency to partner with each person to allow them to, again, narrate however they want to narrate. So we'll move on to the next slide. And so when we think about illness and wellness, there's a couple of different ways in which you can do it. So you can either use what I call a fissure, and you can basically take the soil, you can just basically draw a V in that thing or a line down that thing where you have nothing. You can make it white or black. It doesn't really matter. But the point is agreement with your client in terms of how would that individual want to describe it. And I find oftentimes I get into a fair bit of meaning and meaningful discussion with somebody when I have that sort of representation. We're talking about, I work with people with serious and persistent mental illness, but, oftentimes they also have physical concerns or other concerns that, may be impacting them. And so we narrate those concerns. It allows you to, again, as you can see on the slide, you can, if it's right now, you can see on the current one, how that circle is like an oval on top of the surface because it's quite acute. So if you had like a motor vehicle accident and you had a tib fib or something, or you had, like something along these lines where we're looking at say a 12 to 20 week recovery, you can make that, it's more surface level, and maybe there's a little bit that's going to, sort of over time bleed down and influence, truthfully, it's more of a right now thing. On the other hand, if we look at the one on the right, which is more narrow and deep, that's the way I would represent like a treated mood disorder, where it's there, it's impacting on the surface, it's certainly evident, but at the same time, and you can see the depth of, we were able to temporally describe how long that's been an influence for that individual. But at the same time, it's currently treated. And so there's a narrowness to that versus maybe being a bit wider. Again, as I point out, there's the opportunity to allow the client to narrate exactly how much of an impact. Sometimes I have people and they say, Clark, I want it splashing all over to my relational inputs, and it's touching every one of my pieces of occupational performance. It really allows you to drive meaning with somebody. And the other piece that I think is really relevant, and this is different than other models, is that it allows for us to be able to, in ways, I had a person that wanted to describe the surface of their spiritual soil as kind of ongoing, influenced by their history of substance abuse and their regret and anguish about that, and the kind of loss that they kind of always felt. And they said, it's always there, Clark. And I said, okay, well, do you want me to make it deeper? And they're like, no, it's just always there on the surface. Like, I'm functioning okay. It's kind of an impact there. They said, my other illnesses over here, but that's always there. The cool part of that was that things like grief, separation, substance use, regret, those aren't things that we generally capture in our models. And the SOiL model gives you the space to really go down the path that allows you as a professional to have those discussions at a meaning level. So we'll go on to the next slide. There's space made in the SOiL model for mood and affect. And so we have some room for, and you can use a sun or clouds or dark clouds or rain, but it allows someone to, conventionally describe, when we all describe, like, as young people, it's a sunny day, we're all happy. It's cloudy, these are conventional sort of ways in which people do. You may have a client who sees it differently, and that's okay. They can narrate how they narrate. But typically speaking, I run a kind of graded approach with that. So we go a little darker with the clouds, it's telling me something. And, we go a little rainy, it's telling me something. We have a little lightning. I did have that one time, it's telling me something. And so it allows for me to, again, symbolically describe that. So we'll go on to the next, slide. So the cool part about the model is it also allows for us to narrate concepts of co-occupation and also community participation. And you can link as many SOiL together as you want to with your client. And I've had that where my client's describing their relationship with their partner and, where they see the roots from the relational input impacting across on both of them. And the cool part is that the dimensionality and flexibility of the SOiL model in application allows for us to visually represent, families or other groups, and to look at the shared inputs in terms of how those might inform occupational performance. It's not my first line. My first line is always the individual and doing that work with them and narrating their occupational performance. And I use these often with my initial assessments, for example, and then I have the ability to follow up. The cool part is I'm also, when you do SOiL documentation of this nature, you're able to then go back 3 months later and get a different picture. And maybe the picture is the same, maybe it's different, but we can narrate change over time. And again, it's not the easiest with other tools. The cool part is that it does allow for the client to have total control over that narration. So next slide, please. So there are 5 keys to the application of the SOiL model. The first is our own spirituality. So the sum of experience that we find personally sacred. This is dynamic and consistently informs our perception and understanding of occupational performance more generally. We'll go to the second one. So each one of us has a spiritual soil or base from which all occupational participation is rooted. So practically our spiritual soil is the sum of that experience that we hold personally sacred. This is Pinafore Park here in St. Thomas, Ontario. Go on to the next slide. So all occupations grow or evolve from our spiritual soil. So there's a reciprocality there. So they're both informed by our spirituality and concurrently inform our spirituality in an ongoing way. These can be occupations can be foundational and deeply rooted, or they can be quite temporary, as I described. They can be longstanding, or they can only occur once. There's space made on the model for perfunctory occupational performance too. So sometimes I'll just have clients just put little bits of grass on there. There's things that we do or things that we have to do that we don't necessarily drive meaning for us, but we can tacitly acknowledge that they in ways inform, our lives. So like, I don't know, maybe you go shopping and you have to go grocery shopping. It's not, maybe it drives meaning for you, but maybe it doesn't. Maybe mowing the lawn drives meaning for you. Maybe it doesn't, but it's still there. And so I'll often have someone say, well, it's impacting me, Clark, in these other occupations that are not really super meaningful for me. But when we describe the illness impacts and, you show them and they're just showing small blades of grass because these are fairly transient for them. But it does allow for that discussion as well. So moving on to the next one. Our spiritual soil is nourished and informed by our occupational choices. This is true. Okay, moving on to the next one. And the last one is occupational performance choices, relationships, and illness experience can also be non-nourishing, unfulfilling, and even damaging. I work in a system where individuals are quite often impacted by, very difficult narration of things like addiction or come from trauma backgrounds or abuse histories, where their occupational performance choices may or may not have been nourishing to their spiritual soil, maybe quite non-nourishing, in fact. But that doesn't mean that those aren't, that we shouldn't acknowledge that occupational performance and the impact that has. And if it is damaging their spiritual soil, it probably warrants some discussion as a clinician. And there's the model positively enables somebody a way to respectfully open that door for discussion. So we'll go on to the next slide. So let's try it out together. Now, normally I would do this on Sketchpad. I'll just simply, when I'm teaching it in a room, I usually have I can run two screens, so it's a little bit easier. But basically what I do is, so anyone who's interested, you can use sketch.io to run this easily if you use a laptop, and then just print that, and you'll meet our college requirements because you won't save it. And then you'll add 3 identifiers and you'll sign the bottom of it. So Sketch doesn't track whatever thing that you make. So I've checked in on all of this. Or you can frankly go old school like I do sometimes with Clark's set of markers and a white piece of paper. And it allows for me to do the exact same thing. But Sam is a 34-year-old new Canadian female, long-term partner. She's got a child age 7 and a dog named Ruby. She's a personal support worker, had an auto accident with a tib, fib, and an internal. Is currently stable at home and participating with outpatient PT, and partner supports ADL, and the client can shower, but not independently. She's got a history of anxiety. Is currently managed, though, by application of an SSRI, and so she's quite concerned about her current limitations and return to work. So in referral to community OT, the client has participated in an initial assessment and prioritizes 2 goals: enhanced independence in safe grooming and bathing, and renewal of participation in active parenting. So let's move on to the next slide. And so I'll walk you all through this, but when I conceptualize Sam's occupational performance utilizing the SOiL model, you can see that what we've been able to do is to see that her affect is slightly impacted because of the inputs. Her illness experience identifies on the right with her anxiety disorder, where it's managed with an SSRI. And you can see how it's a long and narrow kind of fissure there, whereas the current illness is much wider and offers like a more of a pooled impact because of the nature of that tib fib with an internal. And so we can acknowledge these things with her, and we can acknowledge the relational inputs on the left with her partner and her dog Ruby. And each one of those things are informing her spiritual soil. And then we can see that her current occupational performance is limited, and in particular that she would like to be able to participate further in some day-to-day occupations, shopping and meal preparation, being able to be a more active parent. And so those were the 2 that she described. And so when I'm doing my work, I ask the person, well, what are the goals that you would like to, actively work on. And so at the top of the page, that's how I do it. I say, what's your goal structure? And at the top, you can see, you know, so she has a desire, you know, to return to more independent self-care, and a desire to return to walking in nature with her son and her dog Ruby. Well, you know, and that I choose those ones for reasons. Okay, this is because those may not be the ones that we would have thought of. You know, we might have thought she's going to have some other goal, but the reality is that's what's driving her in terms of her occupational performance more generally, in her spiritual soil. And so when you work with an individual, it's easy for you to then talk to them as an occupational therapist and say, okay, here's your occupational performance. And you can see where there are some occupations that she's just not doing. There's an empty space under current occupational performance because she's not able to participate in those. So those are just empty, and those are not influencing her spiritual soil in any way. And you can see there's some impact in terms of her day-to-day occupational performance secondary to her tib-fib, which is represented at a surface level. This is impacting her affect, evidently. And so, you know, I think what this enables me to do is to sit with a client and say, okay, so what we needed to work on here is how are we gonna support this occupational performance given this is the nature of your spiritual soil? And it allows for me to have that meaningful discussion and say, okay, these are the directions that, you know, I want to go. The cool part too is that this is visual, and a lot of folks I find in my practice now, a lot of folks find this sort of narration, frankly, much easier even than a PEO, which was my long-term go-to, or a CAWA, which, you know, I find is pretty reasonable as well. But for folks, I find a fair bit of like ease and meaning with that. So we'll move on to the next slide. So if we click on that, I don't know if it'll open for you or not, but if you click on that, it'll open up another web page. Maybe it won't. Oh, maybe it will. Okay, let's see what happens here. So there's a rest of the story here about my model, and I always, you know, end my discussions with it before I take any questions. It's weird that won't allow you to. Oh, there we go. So this particular location is my spouse's farm. So her family has a farm. And this is where I actually first came up with the idea for this model. And so when you look at that and the nature of that, you can see, so most farms behind, by the way, these trees, there's a bunch of older implements that are no longer in use, because if you own a farm, that's what you do with your old implements. You put them all by a set of trees. And so basically you can see that there's a bunch of different crops growing, and you can see these large trees, which, you know, are quite easily symbolic of the longer term relationships. And they're, you know, are different informers into the soil. And so basically that's where the first idea of this model came to me, and how I got there. And then, you know, obviously sort of, I don't know, 13-year journey, you know, to publication and, you know, and presentation. And I've been, you know, really happy with, you know, so much interest in it now. But yeah, so that's the rest of the story. So I always tell people that before I take the questions. All right, so we can probably go back and go on to the next slide here. And so that if you are interested, that particular QR will lead you to my article, and, you know, you can download that thing. And I mean, I've talked about this for 40 minutes. I can assure you that in the 25 pages of the article is much more detail. Dare I say it better explains the concepts probably, but yeah. So that's freely available at Open Journal. And I did choose that as well because I did want for folks to be able to access our content, my content in particular. I often choose open source for our lab strictly for that reason, that I meet folks when I go to conferences and other places who don't have the same kind of resources as we do. And so this one is freely accessible to anyone who'd like to take a look at it. And I'm happy to answer any of your questions at this point.
Thank you so much, Dr. Hurd. That was so wonderful. So we'll just open it up for discussion. I know, Jenny, I think you had a question.
I do. Yeah. Thank you, Jen. So my question or is like the context with clients, like for example, in the community. So would you, with this model, like provide a template to the client if you're sitting down with them and get them to kind of draw things in, or are you just going with a blank page? Like, how does it look?
I usually, I do it two ways. Sometimes if I'm in hospital and I have a laptop with me, I just go to sketch.io and it's super easy. I just, you just draw out a brown part on the bottom, and I'm going to make it easy for the person because they're dealing with like their own kind of narration with me. So I'm not going to make them draw it out too, unless they really want to. Uh, I want to be able to just have that discussion. I'll make it easy for you. And sometimes I just walk down with a piece of paper. It kind of depends on who the individual is and what their comfort is. I'll come down a piece of paper. I got a brown marker. I got a green marker. I got a black marker. I got a yellow marker. I'm pretty good, and a pen. I'm pretty good to isolate everything I want to isolate. And I'm gonna do my standard, dare I say it, College of Occupational Therapists of Ontario, required initial assessment. And so we're going to go through all the usual that you're going to go through, in terms of, confidentiality, and what do we say, all the consent that you just did on your modules, right? And we're going to go through all of that, knowledgeable consent, right? And we're going to go through all those things. In the course of that work, though, you're going to isolate a few goals probably, and you're probably going to hear about some things that are easy or hard. Then I pull out the model. So when we get to the end of that, and then I pull out the model and I say, okay, let's talk about this a little further. Let's narrate this a little bit. And I actually explain to them, I pull back the veil. I'm not telling them, I'm not letting them know. I say, this is how I think about things as an occupational therapist. This is how I clinically reason. You're going to, talk to me about this. And it opens up some cool doors because, like, as an example, I had a person, they're talking about relational inputs. And so we have like, their mom and their dad, and they wanted me to put a really small bush, but they wanted me to just put the roots of the bush and the bottom of the bush. And I said, well, what's that? And they go, well, that's my dog who passed away last year. Now, that's not going to come up, like in some other conversation, but they felt that this dog in their memory really influenced just their day-to-day spirituality. So then I go back to the team and I say, okay, well, we're able to narrate with that person, they experience mental illness, schizophrenia, and they were able to see the influence of that schizophrenia visually in terms of their occupational performance. So they say to me, well, I want to be able to have a job, and they put a hole where they would participate with those occupations. They said, I can't because of this big hole. And so then we're able to enter into a discussion of, okay, well, how could we support that to kind of mediate a little bit, and how would we put some soil over top of that where something could flourish? And then it enables that whole discussion. And they're like, Clark, I could take my medicine. I'm like, that's a start, or like we're able to have that discussion. They say, well, Clark, I'd really like to go to meal prep group. I find that really, I'm like, okay, that's a start. Like, and I'm able to walk them through what I think, and they're able to share with me. And there's a much more reciprocal discussion versus me. I can show your mom a PEO. I don't know that mom's going to understand it. I can show somebody's mom this thing, and they're going to be like, okay, I get it. Yeah, I get who you're at, where we're going here. So for those reasons.
Great. So I have a follow-up question to that.
Sure.
So would you actually like print that and keep the picture in the client's chart?
Totally.
Yeah. And then when you were saying you would do it again, maybe in, let's say, 6 months or whatnot, have you like taken your research to like how you would potentially evaluate the change?
I just published this thing like 2 months ago.
Okay.
And so, honestly, I'm right now, I'm knee deep in like 3 other studies, dare I say it. And, and so, I probably it's out there for us. But, like right now, honestly, I'm spending a fair bit of time like teaching these concepts like nationally, internationally, and meeting with therapists and at different schools. And, I think going to AOTA next spring to present this stuff, like different, OSOT this month, like different places. And so I haven't really gone to a place that looks at, evaluation side, but my sense is that it would be really hard. And the reason why I think that is because we're talking about the unique individual narration of your client and the unique individual narration of my client. How they even conceptualize the spiritual soil is often different. And, I provide a template for you as the clinician to work with, but I'm giving you all the room in the world to adjust that to whatever is going to drive meaning for your client. And so if they want skyscrapers, give them skyscrapers. If that's mom and dad, so be it. They want houses, so be it. They want shrubs, so be it. If they want depth, so be it. They want rivers. I've had all of it, right? And the idea is to give them that space to be able to narrate it exactly how they want to narrate it. And that's a big change for us as a profession. Our models have been about us. Our models haven't always been about, the client. And they certainly haven't been about sharing the secret knowledge of how we clinically reason.
That's great. Thank you. Yeah, I relate to the example because I am a community therapist, and I definitely could see this being a different way to approach to use and practice. So thank you.
Thank you.
Mike, I think you had a question.
Oh, yeah. So, Clark, thank you so much for presenting this. It's really nice to see the culmination of so many years of work and trying to demystify and make such an important concept more usable for the profession. You mentioned the CAWA model a couple of times, and as you were going through your model, I kept thinking about how there's similarities in what you're presenting in terms of how you can customize it, how it's dynamic, you can make changes over time. I'm wondering if you drew on the CAWA model for inspiration in doing this.
I think certainly Owama's work, I was aware of it and I followed his model for, a number of years. The difference essentially between our models is he's narrating via a cultural lens, and I'm narrating via a lens of spirituality. And that's the essential difference. So for me, the SOiL is about your personal spirituality, whereas, he's taking it through, a sort of Eastern worldview from a cultural lens. And I think that the other pieces that are quite different are, by the way, I really like his work, but I think that the pieces that are different are in SOiL, all of the determination is given to the client. And so we are running narration of, like in CAWA, we are running narration, obviously with the rocks as the permanent, points of disability, and the logs as the temporary points of disability and similar. And, whereas in SOiL, what I'm talking about is the space, I guess, for you to narrate your own personal experience of spirituality and the sum of experience that you hold personally sacred and how that's influencing your occupational performance. All those decisions are given over to you. So it's a fairly major departure between the two models, and it's just essentially basically a different focus. I think there's space in our profession for like both concepts. And having met that guy, I think he's a good dude. So,
thanks, Clark. I see Julie has her hand up. Julie, you have a question?
Hi there, Clark. It's nice to see you. I went to school with you many years ago, so
it's nice to see you, Julie.
Just wondering how or if you see this working. Like, I work mostly with like outpatient orthopedics, so where I might only see people for a couple visits. I'm just wondering your thoughts on that, if you kind of see the model working in that kind of setting.
Yeah, I mean, I think it humanizes your discussion. My spouse owns a rehab company, and they do physical medicine a fair bit, and may or may not have like a significant number of visits, right? But if you're running an initial with somebody and they're wondering, well, what the heck are we focusing on as occupational therapists? It's pretty easy for me to, it doesn't take me like 5-10 minutes to run the model. It's not super long, right? So basically drawing some SOiL, and when we're looking at your inputs, and it allows me to then frame the kind of work that I might want to do. And so even if it's something like as dare I say it, perfunctory as me recommending, a certain physical build in somebody's bathroom, or certain, tools that they might need, for safe bathing. I'm able to at least draw that out and say, okay, this is where our illness is right now. This is how this is impacting you. And they say, yeah. And I say, okay, well, how does that, when we talk about their spiritual, their spiritual inputs there, I say, okay, if we do these interventions, then, we can mediate where this current fissure is that's impacting you. They say, okay, I haven't been able to independently bathe for 4 months. Okay. Well, what are we going to do about that? Well, if I put this in place, and I say, well, how does that make you feel? And they're like, well, they say, well, I don't want to meet with my friends. I don't want to do other factors. I'm like, okay. So I'm able to actually talk with them about that. And then I'm able to visually symbolize that for them. And I think it makes it easier. This is often, I find the same thing with our outpatients in mental health here. I'm able to symbolize with them exactly why we're doing the work we're doing. And I think for services like your own, it just allows that narration versus the person kind of having to problem solve it.
Awesome. Thanks.
Any other questions?
Sure, if it's going to automatically end at 1 o'clock. But the last question I had, Clark, was just in relation to use of the model with certain patients, and if you can reflect on, I guess, what your biggest challenge has been in using the model with patients.
I think that people aren't used to being engaged in their care outside of spiritual care. And so my research colleague is a spiritual care professional. And we talked for years about spirituality in OT. And it's the center of our model, and it's all important to us and stuff. But I'm not sure that it's been a professional priority. I'm not sure it's been a professional practice priority. And, and I think, you would know from faculty life, Mike, that we talk about it as the center of our model. We talk about the importance of it, but study after study from students tells us that they don't feel prepared, that they don't feel like they can use it. And, I think clients the same, when suddenly someone's sitting with you and saying, all right, let's talk about what you hold personally sacred. I'm shifting the power dynamic, and particularly within a forensic environment, is eye-opening sometimes for people. And shifting that power dynamic, I think in any environment really, and I think we have to acknowledge that, the power differential between us as clinicians and our clients, and the implication of that. And so you're sitting with someone and you're saying, okay, we're describing this, but you're kind of driving the boat here. And this is how I'm going to clinically reasoning, and I'm opening the, I'm walking you down a path that's helping you to understand what I'm trying to do. And it's just interesting because I think people feel empowered, but sometimes initially they're like, okay, so, they're waiting for the other shoe to drop, or like they're wondering, okay, why is this guy drawing this, and explain it to them. And then once they're able to get there are cases too, Mike, in thinking of your question, where, it's not always if you have a client who is unable to think symbolically because of their illness. So you have someone who's unable to, you might just use this for your own work. You might do your initial with that person, their SDM, and, you might deal with, those inputs as you have to professionally deal with those. And you might, talk to them about these concepts, and it might enable you to use the model to problem solve their occupational performance. And, you're going to be measured in how you share that with the individual, because, sometimes you have individuals for whom, they're maybe not able to cognitively process that. And that's, I just acknowledge that in my documentation.
Oh, thank you so much, Clark.
Thanks, Mike.
Again, I do want to say thank you, Dr. Hurd, for today's presentation. It was very well done. Again, it will be posted to YouTube. So thank you again. And have a wonderful afternoon.
Well, thank you so much, Jennifer. Thank you, Michael. It was really a pleasure to be able to talk to everybody here. And I'm always happy to talk about the model.